Lung cancer, unfortunately, doesn't have a lot of symptoms. You're not going to have a lump or a bump or anything that is going to tell you that something's going wrong early. So the only way we know that this may be there is by doing these screening tests.
CT lung screening involves use of chest CT at a lower radiation dose than is typically used for chest CTs. The whole purpose is to find small abnormalities in the lungs and in the chest that might be an indication of an early lung cancer.
By screening for lung cancers and detecting lung cancers earlier, you're able to provide treatment and a higher cure rate for cancer. You're not enclosed in a machine like an MRI. The actual scan takes less than 10 seconds. So you're in and out pretty much in about 10 minutes total from the time you go into the room and you come out of the room.
This is the best part about lung cancer screening, and it's so very different than other cancers that we screen for. Literally, you don't have to get undressed. There's no needles or pokes. You can have lunch beforehand. You don't have to, not have anything after midnight. You just basically come in and you lie down on the CAT scanning bed, and then you're done.
People that are higher risk, people who are over 55, people who have smoked at least 30 years, and people who either are still smoking or have stopped in the last 15 years. They are in a higher risk category and would benefit from screening.
In order to have a CT lung screening, it requires a physician's order. You want to sit down with your primary care physician or your pulmonologist and go over if you meet the criteria.
160,000 patients die of lung cancer every year. It's estimated that if everyone went through the lung cancer screening program that was eligible, we could save 20,000 lives per year. If a patient has a positive screening test that then leads to a cancer diagnosis, we have all the professionals here within the Sentara Cancer Network that are needed to take that patient through their care from start to finish.
If you have any questions about your CT screening, you can call the Lung Screening Navigator at 1-855-EARLY-DX.